For that right here, we're going to do retraction or adduction, the same thing, right? All you do is hold the arm straight out like this, bring it back. See it? Now, as they're coming back, you say, now I want you to hold it there for me. Don't let me pull you out. Grab a little tug. Don't have to do this. Okay? Don't need to get any leverage on them. Why? It's the most it can be is a 4 plus. Does that make sense? Muscle, rhomboids, major and minor. Okay, so that is the scapula. We elevate, up, we depress, get behind the vertebral borders. Okay, we protract, and we retract. Now, to elevate, upper traps, middle traps. To depress is your lower traps and your rhomboids. Lower traps and your rhomboids. Okay, to abduct the scapula, meaning out, coming out, or to abduct it or protract it, that is your serratus anterior. Hooks onto the ribs, to the scapula. Okay, bringing it back is your rhomboids, major and minor. We good? Okay, where are those muscles at? Okay, if you want to palpate the serratus anterior, it's right here on the side. If you want to palpate the traps, diamond shape below the neck. If you're going to do the rhomboids, right between the scapula. Yes? Okay, that's the scapula. Elevation, depression, protraction, retraction. Shoulder flexion. Always thumb up. Book shows the wrist down like this. Technically, I always do it this way because it clears the chromium process and prevents injury. All the way up. Give the resistance. Push down. Okay, she has full range of motion against gravity. Maximum resistance, she can hold that. What is the muscle? The anterior deltoid. Coracobrachialis is a secondary mover. Now, I want to eliminate gravity. Everybody sees why this is against gravity. It says sagittal plane, up to the ceiling, transverse plane, gravity eliminated. Think parallel to the floor, parallel to the table. Okay? Now, gravity eliminated, we'll lay on your side, and I'm going to just put you this way, and same motion, only I'm going to give the resistance, a little less resistance right at the end range. You see why it's gravity eliminated? Went parallel to the floor, parallel to the ceiling, parallel to the floor, transverse plane. Give the resistance at the end range. Okay? Okay, so that's shoulder flexion, hop back up. Now we want to do shoulder extension. Now, here's what you want to avoid. Avoid this like the plague. A lot of people do this. I saw it in the clinic the other day. I saw two things that annoyed me. One of which was one of my former students who was teaching one of my current students, and it was like, I wanted to say, you know, we're really doing this wrong, but I didn't want to correct him in front of patients. So we'll talk to him later. He was doing extension, and he said, okay, come down. Come all the way down. Is that extension? No, it's not. That's actually wrong. You remember I told a rule of thumb, you never use gravity to assist you. Extension is from here to here, 0 to 50 degrees. 0 to 50 degrees. Arm here, thumb up, straight back, 0 to 50 degrees. What's the muscle? Latissimus dorsi, all the way in the back. Posterior deltoid, triceps, and coneus, if you really want to go into a bunch of extraneous muscles. All the way back, give the resistance, push down, one joint below, one joint above, push down. Gravity eliminated, lay them on their side. Doesn't change, same as flexion. Does that make sense? Okay. Okay, so we did, now let's do abduction, ABD. Thumb up, out to the side. We're talking middle deltoid, which is right here. Here's the anterior deltoid, middle deltoid is right here. Comes all the way up. Give the resistance, push down. One joint below, one joint above, push down. And that's actually for abduction. To actually do gravity eliminated, we actually lay down. Go ahead, lay on your back, please. And you come all the way up. Resistance at the end range. No more than minimal resistance. 4 plus is the most you can do. All the way up, give the resistance. One joint below, one joint above. Now, I'm going to throw a curve at you. I want you to think. For those of you who were not in the first group you don't answer this. Adduction. Adduction. Okay, when you're doing adduction, you test it the same way. Against gravity, just like depression of the scapula. You test it the same way. You have them lay down, and you have them come in this way. The only way you can truly test it against gravity is to do a tilt table, but people don't always have that unless there's in a clinic. So you just have them come down and give the resistance. Come down. And it's in a gravity eliminated versus gravity plane because it's tested the same way. Does that make sense? One joint above, one joint below. That's the only one that applies to other than depression to the scapula. Okay, we good on that one? Okay, sit up, please. External rotation. I'm going through my head here. I don't have a sheet in front of me. Arm straight out like this. Okay. Hold motion 0 to 80 degrees. Muscle is your infraspinatus, supraspinatus. You can feel it on the back. Is actually give the resistance right by proximal to the radius, distal to radius. Come up, go up. Give it that way. Okay. If you have patients that actually have a labrum tear and they can't hold their arm like that, you can cheat and actually help them and say, now come up. See what I did? Because I don't think she's going to ask you about labrum tears. You come up and you just give the resistance. Gravity eliminated. Put your arm by your side. All the way out. Okay. All the way out this way. So everybody come out. And that's your infraspinatus. Okay. 0 to 80 degrees. The key to this, keep the elbow in tight. Bring the elbow out. Forearm out. Internal rotation. Lay down. On your back, I'm sorry. Internal rotation, bring the arm out into external rotation. 90 degrees. 90 degrees. So we have the 90 degrees here and here. I'm going to drop you just a tad. Now we're going to come up, and I'm going to give the resistance. Come up, please. Keep coming. See it? Where am I giving the pressure? Proximal to the radius, distal to the radius, and all. Come up. The key to this is that they're not doing this, elevating, subluxating. Up like this. Good? Okay, muscle, subscapularis. Subscapularis can't be palpated anteriorly because it's basically underneath the deltoid. So you actually have to palpate on the distal way and actually in the back of it. So it's pretty hard to palpate. You can feel the fibers fire if you need to. But go ahead, come up. You can feel it over top of the deltoid, but it's actually deep to the deltoid. Does that make sense? And you'll see this tomorrow in cadaver lab. Gravity eliminated. External, internal rotation, this way. External rotation, this way. So you're sitting up and doing it this way.
And you still just place your two hands here?
Yes. Yeah, same way. Give the resistance to the proximal head, distal head to the radius and all. Yes? Mm-hmm. Question?
So with gravity eliminated external rotation, is the infraspinatus, supraspinatus not the primary muscle?
It still is.
You said infra only.
Well, what happened is infraspinatus is the primary, supraspinatus. I guess they work together because they're part of the rotator cuff. Yeah. And in fact, they work together because that's the exercise when somebody actually has an impingement syndrome or they have a rotator cuff pain. And other than doing pendulum exercises, I start them on internal and external rotations to strengthen the humerus that goes into the glenoid cavity.
What about teres minor then?
Teres minor, teres major. They all help. Sure. It's really your sits muscles.
Yeah.
Okay? All right, is that good for that? You understand hand placements. Mm-hmm. Let's sit up, please.